Hi. Over the past years, we have seen how partnership could be life-changing. It is an honor to talk about this collaboration between Partners in Health, the University of Global Health Equity, and the Aspen Global Innovators Group. And in this conversation, you will hear from the organizers and the leadership behind this initiative. I am Manzi, Deputy Chief Medical Officer at Partners in Health.
I'm Lola. I'm the Executive Director of the Aspen Global Innovators Group.
And hi, I'm Lisa Hirshhorn. I'm Professor in the Feinberg School of Medicine at Northwestern University and Director of the Ryan Family Center for Global Primary Care at the Havey Global Institute, and on the steering committee for this very exciting initiative.
Hi, I'm Anil Krishna. I'm the Professor in Global Health, working as a Director, Center for Leadership in Global Health Equity at UGHE, and leading this project from the UGHE side.
Why investing in the health and resiliency, and why now? Let's start with Lola.
Well, we should always invest in strengthening health systems, especially from the primary care level on up, in order to make sure that we're delivering high-quality services to those who need it most. However, I think we've all learned post the pandemic the power and importance of starting at the community level and authentically engaging leaders from government, from research, from policy practice to think through how they will build systems that coordinate effectively together to respond not only to crises, but to the day-to-day needs of community health residents.
Yeah, no, I really sort of couldn't agree more. I think, we've learned a couple of really hard lessons that we probably didn't need to learn. I think probably the two most prominent ones in people's minds are the Ebola outbreak and then more recently the COVID pandemic, where there were certainly some countries that really were more resilient in their ability to detect, to prevent, and to respond to the threats, whether they were the direct threats of the infection or of the response to the infection, for example, COVID during the shutdowns. And so, places like Rwanda that were able to, prevent the introduction of Ebola, and then also were able to really mitigate, if not actually prevent, a lot of the reduction in primary health care, really sort of says we need to learn and we need to understand how countries are able to be resilient before, during, and after the shocks.
Yeah, I fully agree with the points. And adding one point, essentially, when you think about the health system and community resilience, it should be a continuous process. So, we are anticipating more and more pandemics in the future. So in that scenario, there's an ideal time we think about community health system resiliency. That's it.
Thank you. I have a follow-up question here. We have seen that leaders, community leaders especially, have played a key role in responding, but also helping communities to recover and to become more resilient. Can you talk a little bit about the role of community leaders, especially with this new initiative, starting with Lola?
Sure. Well, the wisdom is across the room, but I'll say first, I love the way you phrase it as community leaders. I think at the start, people assume that it's just the community health worker and their role to be the solution finders at the local level, but we have to think beyond that individual CHW and what other types of leaders we need to bring in and what kind of new capacities they need. One of the concerns we have right now is the fact that leaders show up in different ways, in different forms when a shock hits, and there's a burnout factor. So investing in their showing up when we need them the most, that is not just paying them, but investing in their visibility, amplifying their voices, connecting them to other colleagues who are also faced with the same challenges is key. The other reason why I think it's important to invest in the leader now, beyond the health workers, is we have to leverage the significant investments that have already gone in to designing community health worker programs. So how do we maximize those billions of dollars that were committed by philanthropy and governments already? How do we maximize that investment and codify what it is to be a true community leader so that they can take their certificate, their training to the government or to another partner and be seen as an accredited, highly valued, trusted community member who has a solution to shocks, but also to ensuring that there's connectivity and trust at the primary healthcare level.
Yeah, I think you really hit on something really important right at the end about trust. Because, you said that community leaders were great in responding, and I would say it depends.
Mm.
So I think we really did see a lot of diversity in terms of who actually was able to respond, who actually didn't believe. There's a lot of misinformation in people's belief. So I think training, understanding the competencies that community leaders need, I think has really evolved very much. So it used to be they need to inspire, they need to have authority, but they need to actually understand data and evidence. They need to really demand, as an implementation researcher, I would love community leaders to say, this is the evidence I want. This is the way that I need to know whether things are working or not. So I think we have gone beyond, again, the idea of somebody who's inspirational, that being important, but understanding what are the other skills they need. And I think this is probably one of the more challenging things is, and so therefore, who are the best positioned to be the community leaders before, during, and after, whether it's a pandemic or all the other shocks that are coming through climate or other things.
I like the point you raised about competencies. When we talk about the competencies of a leader at the community level, which has not been defined, mostly we talk about the competencies at a larger level or an academic perspective. But that is very much important and critical for sustaining the community level programs across the globe. And when we talk about health system resiliency, this is critical, and we will be focusing essentially on that aspect.
Thank you. This is really powerful, especially as we have been accustomed to traditional definitions and sometimes it's not clear. Now I would like to go into community health systems. We just talked about leaders, but leaders, to be effective, they operate in a system, or they have to set up a system that works for them but also for the community. Can you talk a little bit about community health system strengthening? Why is it really important, and how this initiative is going to be unique in addressing that? I can start with Lola.
I can't take it all, but I will say one unique aspect of this program is we know that community to community, no matter what the GDP, the challenges we face are so similar. So we have intentionally designed this program to bring wisdom and expertise from leaders in the U.S. and also leaders from around the globe to really learn together and design programs that really, one, democratize the challenge, but also democratize opportunities to create solutions. So the thrill about this opportunity is, this group, this community of fellows are coming in with an open mind to get this sort of skills, the concrete technical skills, to then create a breakthrough idea. And they'll learn together failure and successes about how to really apply a community health systems model that is culturally relevant, grounded in evidence and data, but also that tests what the systems around them can take. And so we don't have an answer. That's kind of the brilliance of this model, is we are really trialing something new, testing new ways of working, building new trusted relationships across places and spaces, and we will find out together what community health systems resilience looks like globally.
No, I think that's good, and I think that's sort of the really exciting part of it, is that, not saying, okay, well, we know how to do this, so now we're going to just scale it up. You see, trying to figure out, how do you do this? How is this similar? What can we learn from health system strengthening? What can we learn from health system strengthening that has not been effective and that has not been sustainable? And then, really bringing in a lot of the things that we've learned about adaptive management and, and data for action, and people being willing to sort of share challenges and failures to actually move forward. So bringing in Manzi, quality improvement type methodologies into these types of things, as opposed to leaders who always felt like they were the voice of authority and they should speak with, as we sometimes say, sometimes right, never unsure. So I think we want them to be sometimes unsure and more usually right, but helping, what are the skills that they need to do? And then I think the other thing that's so fascinating, if you look across this group, we're a very transdisciplinary group of people. We represent very different backgrounds, very different training, but that's the other thing, is getting the leaders to understand, how do they create that team? How do they listen to the community? How do they listen to the people in the community who actually know what the answers are? So they will know more than if you brought somebody externally, but we also have to teach them to listen in the same way that we're teaching everybody else. So I think it's a really great thing. I'm going to, of course, bug you about, so what are your metrics of success? But I'm sure that's something that will come out as you keep on this very exciting journey.
Yeah,
I stress on the point what Lola was mentioning about. We don't know how it is going to be, which is precisely a fact. We have a health system resiliency framework available. We have a community framework available. And how we could integrate both and come up with a community health system resilience. That's going to be the model.
Thank you. And I have a follow-up question, and this one is to Lisa. In one of the sessions, you cited this quote, well known, that every system is perfectly designed to achieve the result it achieves. And the current community health system did not necessarily help to cope with what we have gone through and is not prepared for the future. What systems and competencies and changes do you think have to happen to be ready to recover as fast as we can and to be ready for future pandemics and crises?
So I'm going to add one more thing, which is, my idea of resilience is good care in good times and bad. So to recover to bad care is not a success. So I think it is understanding, how was the system working before and how did it work with the stress. I do think I'm a huge fan of positive outliers because I think they can really teach us. So even in a country where things didn't go well, you probably would find some areas of the community health system that did respond. In other countries, it was probably more broad. So my first thing is always, rather than go and look at the failures, go look at the people who succeeded. So what were the strategies that they put into place? Was it how they engaged the community? Was it empowering women? Was it, making sure that everybody had better communication? And then what were the factors that either helped or hindered them? So, obviously if you're in a community that's being served by this health system, that is a stronger community, it's a wealthier community, it's a healthier community, that may be something that helps them. But then the answer is, okay, well then you need to bring up the health of other people to help with resiliency. I do think, and as Anil pointed out, there is, the resiliency framework that Margaret Krupp and colleagues developed that I think has some really key things about being able to be adaptable, to be able to detect these things. And so again, it's teaching people how to continuously adapt what they're doing. But it's also really important to make sure, we talk about decision space. And if you give people responsibility without that authority, it's never going to work. And so also understanding where is it that the community health system there have to be able to make decisions. And then finally, it can't be standing alone. Community health systems are often the front line appropriately for primary care. But if we can't figure out how to link them to the next levels of care in a sort of continuous, comprehensive, coordinated manner, it's not going to be resilient and it's not going to deliver good care.
Thank you. I want to come back to our institutions. So, Prof. Anil, if you can speak to the role of academic institutions in helping leaders to engineer resilient community health systems, that would be great.
Yeah, see, when we think about academic and implementing and community health, when you look at that, there is a gap. Essentially, people are considering academics are only for creating future health workforce. That's what the concept currently. We need to break that. This is one of the forum where we can bridge that gap. The community leaders are going to be in an academic institution and we are making them or fine-tuning them towards a better community leaders and who will be taking the role of building resiliency at the community level and at the national level, the policy levels. That's what the role as an academic institution, and eventually the Global Health Academy is going to be the center of excellence. That's what the aim which UGH is looking forward.
Thank you. I'm going to come back to Aspen. Lisa just used positive outliers, and that's what Aspen does, is bringing all those together. And now we have a partnership, Aspen Partners in Health, the Universal Global Health Equity, and so many more partners are lined up to join this effort. Can you speak to the power of that partnership and that network of leaders in making this happen? And if you can even talk a little bit about the first cohort. Who is in it and why that?
Sure. Well, first and foremost, you asked at the start the why now? And it speaks to the why aspect. So many of us have heard the call for localization and the need to invest in local leadership. And what we do hear from funders and partners alike is we can't find these local leaders, or we can't fund these local leaders, or they don't have the evidence or proof enough to thrive in this complex global health landscape. The Aspen Institute is a complex web of incredible leaders from all political sides around the globe who are trying to redesign society in a way that works for all. We have a number of leadership programs, but that's really the core of our work, is focusing on investing in individual leaders, but also creating spaces for convening and solutions-oriented dialogue. We need that to then build something that works. We are adjacent from policy or adjacent to philanthropy. We're in this beautiful nexus that enables us to have meaningful partnerships like these. So through our group, we've spent the last 15 years or so running fellowship programs that identify individual leaders who have incredible visions, who have solutions at play that have been tested and trialed, but need the visibility to scale and replicate, and also to show that they are endorsed as proven leaders. But we can only go so far with individual leaders, right? We want to think about how do we respond to a localization call that can have population level impact. And we know that we need academicians, we need policymakers, we need practitioners, we need activists, we need organizers. Our network is a network of about 300 individuals around the globe in 55 countries who are exactly that. They represent all of those parts. So we can build on that wisdom and expertise. But we are also centering our investment in this partnership around rebuilding, strengthening health systems for all. And that is a rare privilege. And I have to note that we're all interconnected in so many ways. We bring so much wisdom through our history of working together as individuals from different institutions, and we're bringing that to bear now in an epic way to really create a new program that will be additive, one, by proving centers of excellence, but also additive around the globe. So it is a real thrill to bridge individual leadership and the power of a network with colleagues and partners who are longtime trusted. The first cohort will include 16 leaders who are from the US, North Carolina, Minneapolis, Massachusetts, and Chicago, as well as leaders from Lesotho, Malawi, and Rwanda. They have leadership roles within the Partners in Health Network, but also are leading institutions or playing leadership roles in NGOs, civil society, and other organizations that we're bridging together. So we know the power and wisdom that they're bringing to this community that we'll test and trial, and are really thrilled again that there's going to be a real nice platform for trust building, but also for shared learning across geographies.
And this is one of so many cohorts coming up. I have to also say that Partners in Health is an invaluable partner in this collaboration. We value the contribution of the community. We also promote these community design and driven initiatives. I can't think of a better partnership to launch these initiatives. So I'm so excited. Now as we wrap up, one message for someone who is watching us, ready to take part of this program. What do you say? Let's start with Anil.
This is an opportunity where you can get a multicultural environment in terms of both learning and practicing. And UGG as an institution, we provide them the different types of learning and using the different type of learning methodologies, and you are going to get excited, I'm sure, and later transforming community health resilient leaders.
Thank you.
I would say you are an expert. You're an expert in what you do. You're an expert in what you know. But you also have, you have an enormous amount of additional tools. I always tell people, what's in your toolkit? So thinking about what are the other tools you can put in there in terms of the competencies. What's the network? I think the power of a network, you probably have your own local network, but how can you expand that out? and how can you really learn from each other and teach each other? And speaking as somebody who is based in an academic institution in the US, how can we learn with and from you? What are the questions that you think that researchers like me need to be asking, need to be helping you understand? And how do we actually continue to move forward to really achieve, all these great innovations that have been developed to make sure that everybody gets them everywhere? And that, I think, for me that's the goal.
And I would say that over the past years, we have seen that pandemics and humanitarian crises that are emerging don't target just an individual town. They are global. I'm so thrilled that we can have a cohort of global leaders getting together to think together and act together as a reserve force for community health and resiliency.
I'll just close with, I think, soft but powerful I'm a proponent of joy and patience. And we know how much work you have done to get here, and we also know how much more work there is to do. So I am hopeful that what you will find in this community is also not just wisdom and expertise, but joy in learning together and being honest about what's possible and understanding that you may not solve your challenge at the end of this course. That is not expected. But what is expected is you will have captured a lot of solutions, a lot of hope and possibility that then will bring more energy to your work, to your organizations, as we build and rebuild together.
And have fun.
There we go.
Yes.